Have you heard of autoimmune diseases, also known as connective tissue diseases? What kind of image comes to mind when you hear it? An autoimmune disease isn't very well known and often goes unnoticed, but in the United States, singer Selena has openly shared her battle with lupus, a serious autoimmune disease. It may not be widely known, but an autoimmune disease can be life-threatening. Because it's not well understood, diagnosis and treatment are often delayed, meaning many people are diagnosed only after the disease has progressed. So today, to prevent that kind of regret. Even if this is the first time you've heard the term, you'll be able to understand it clearly. We will thoroughly explain what an autoimmune disease really is, what changes it causes in the body, and why it's so dangerous. Symptoms of an autoimmune disease can suddenly appear in your daily life without warning. Since this isn't a disease we hear about often, let's learn together so we can respond calmly and correctly if needed. Hello, and welcome to the Preventive Medicine channel. Today, we're going to learn something very important for your health. Today's topic is an autoimmune disease. If you watch this video to the end, you'll understand an autoimmune disease well enough to explain it to others. So please stay with us until the end. We'll also cover possible prevention strategies. So, let's get started. First, what exactly is an autoimmune disease? Most people wouldn't be able to explain it if asked, so I'll break it down in a simple and easy way. First, let's take a look at a term often mentioned in connection with autoimmune diseases, collagen-related diseases, also known as connective tissue diseases. For many people, this may be a new and unfamiliar term. So, what does a collagen disease actually mean? Simply put, it refers to a condition where inflammation or abnormal immune reactions occur in collagen, the protein that connects and supports the body's tissues. Although many people think of collagen as just a skin or beauty ingredient, it actually plays a major structural role in the body and is found in muscles, skin blood vessels, organs, joints and tendons. In other words, collagen acts like the body's biological glue, holding everything together. However, when the immune system becomes overactive, it mistakenly attacks the body's own collagen instead of protecting it. This results in inflammation and can lead to symptoms such as joint pain, skin changes, blood vessel inflammation, muscle weakness, declining lung function. For this reason, these conditions are medically referred to as connective tissue diseases or autoimmune connective tissue disorders. Many people associate collagen only with skincare or moisture retention, but, in fact, collagen functions like a biological adhesive, helping connect and support tissues throughout the body. It connects tissues to tissues and cells to cells. In medical terms, this is called connective tissue. So without collagen, our bodies would literally fall apart like a plastic model. In summary, an autoimmune disease is a condition that affects collagen, meaning it affects the connective points and structural tissues of the body. So what exactly happens to collagen that leads to an autoimmune disease? In an autoimmune disease, the immune system, which is meant to protect us, begins to malfunction and go out of control due to unknown triggers, causing inflammation throughout the body. In the body, immune cells, such as white blood cells, act like police, but sometimes they mistakenly identify parts of their own body as foreign and begin attacking them. Diseases that occur this way are medically classified as autoimmune diseases. An autoimmune disease is also included in this category. However, because an autoimmune disease specifically affects connective tissue, it can affect blood vessels, connective points, and structural tissues throughout the body, where the immune system repeatedly triggers inflammation and immune attacks. When this happens, tissues and blood vessels gradually lose elasticity and normal function, leading to various symptoms. That is essentially how an autoimmune disease progresses. And importantly, an autoimmune disease is not just one single disease. It refers to a group of diseases that share similar characteristics. The most well-known condition within this group is rheumatoid arthritis. In fact, there are more than 30 known types of collagen-related autoimmune diseases. Just like cancer is a category that includes lung cancer, stomach cancer, and others. The autoimmune disease group contains conditions such as dermatomyositis and Sjögren's syndrome. So while there are many variations of an autoimmune disease, they often share overlapping symptoms because they belong to the same category. Now that we've covered the basics of an autoimmune disease, Let's move on to the warning signs that should never be ignored. Why some people lose their lives to these conditions, and whether there are ways to prevent or manage them. We'll explain these important points in the upcoming section. On this channel, we share science-based medical and health information from a physician's perspective, so subscribing will definitely benefit you. All right, let's begin explaining why an autoimmune diseases can be so dangerous. The first symptom we'll look at is this one. As you can see, the upper eyelid is swollen and puffy. This is actually a known symptom seen in certain and autoimmune diseases. In fact, this symptom is well recognized among physicians and even appears in medical licensing exams due to its significance. This symptom occurs in an autoimmune disease called dermatomyositis. This condition tends to occur more often in middle-aged women. Dermatomyositis, just as its name suggests, is a disease in which both the skin and muscles are attacked by the immune system, causing inflammation. In terms of skin symptoms, the upper eyelids are especially vulnerable. This specific symptom is medically known as a heliotrope rash, but it's not only dermatomyositis that presents this type of change. In many autoimmune diseases, the skin becomes a frequent target of immune attacks. It can cause redness, swelling, or rashes, not only on the eyelids, but also on the hands, feet, abdomen, and back. So, it is very common for the earliest signs of the disease to appear first on the skin. For example, in an autoimmune disease called SLE, systemic lupus erythematosus, a symptom called a butterfly rash often appears. A red rash forms across both cheeks, resembling butterfly wings. In an autoimmune disease called adult Still's disease, a rash known as a salmon pink rash may occur. It appears as raised, pink-colored bumps on the arms or legs. So in many autoimmune diseases, skin symptoms appear early and frequently. Because of this, these symptoms are sometimes mistaken for allergies or common rashes, delaying diagnosis. It's nearly impossible to self-diagnose an autoimmune diseases, but if you remember these symptoms, along with those we're about to cover, you'll know when certain signs accompanied by skin changes may require medical attention. Earlier we mentioned that dermatomyositis is an autoimmune disease that causes inflammation in both the skin and muscles. So what happens when the inflammation mainly affects the muscles? As you might expect, one common symptom is muscle weakness caused by the immune system attacking the muscles. For example, the arm muscles may weaken, making tasks like lifting laundry or hanging clothes difficult. Weakness in the legs may make climbing stairs difficult. Some people first notice the disease when they struggle to stand up from a seated position. Most people would never guess that muscle weakness and rashes could be caused by the same disease. This is one of the alarming characteristics of an autoimmune diseases. Because connective tissue exists throughout the body, skin, muscles, blood vessels, these diseases can cause a wide range of unpredictable symptoms. Now, the next symptom I want to introduce is this one, a persistent feeling of fever, joint pain, and fatigue that doesn't go away. Many people think, what is going on with my body? Does it sound familiar? Yes, it's very similar to influenza-like symptoms. And autoimmune diseases can sometimes cause symptoms that look just like a cold or flu. But when you understand the mechanism behind it, it makes sense. As mentioned earlier, an autoimmune diseases occur because the immune system becomes overactive. Sometimes the immune system is attacking viruses or foreign invaders, and sometimes it mistakenly attacks the body's own tissues. In both situations, the immune system is overactive, just like during a cold or the flu. That's why symptoms like fever, body aches, and joint pain occur. At first, it may feel like just a common cold, but if the fever doesn't go away and you start to develop a skin rash, when flu-like symptoms continue for several weeks, or even more than a month, you should consider the possibility of an autoimmune disease or another underlying condition. Up to this point, we've talked about how an autoimmune diseases can cause inflammation throughout the body's connective tissues. So where is the worst place for this inflammation to occur? The answer is the lungs. There is a very strong connection between an autoimmune diseases and lung damage. This is because there is a specific part of the lungs that these diseases tend to target. That part is called the interstitium. When inflammation develops in this area, it can lead to interstitial pneumonia. Inside the lungs, there are countless tiny air sacs called alveoli, arranged densely like a honeycomb structure. Many of you may already be familiar with this. The tissue layer between these alveoli is called the interstitium, and because an autoimmune diseases target connective tissue, the interstitium becomes an ideal site for inflammation. Inflammation may repeatedly occur in this area, causing ongoing and chronic damage. So what happens to the lungs when this damage progresses? Over time, the interstitium becomes stiff and rigid, almost like an old rubber hose, making it difficult for the lungs to expand and contract normally. As this continues, the lung function gradually declines, and eventually, the lungs may no longer provide adequate breathing capacity. This is why an autoimmune diseases can be life-threatening conditions. However, because proper treatment can help manage the condition, please make sure to understand this disease through this video. Now, let's talk about one of the most common symptoms seen in an autoimmune diseases. It is morning stiffness in the hands, when your fingers feel stiff after waking up. Just like a machine running without enough lubrication, when you wake up, your fingers don't move the way you expect them to. You may feel stiffness or tightness in the joints. When this symptom appears, it may indicate one of the most common in autoimmune diseases. And that condition is rheumatoid arthritis. In rheumatoid arthritis, the synovial membrane in the joints becomes a target of the immune system, leading to this kind of stiffness. Of course, mild stiffness in the morning can happen to anyone, and it does not always mean rheumatoid arthritis. However, if this morning stiffness lasts 30 minutes or longer, it may be considered a key sign of rheumatoid arthritis. In such cases, it's best to consult a doctor. Next, let's look at a symptom that appears in the fingers. As you can see, the fingertips have turned pale or white. So what exactly is happening here? As mentioned earlier, an autoimmune diseases can cause inflammation in connective tissue within blood vessels, meaning this disease can affect any part of the body that contains connective tissue, from head to toe. When inflammation repeatedly occurs in the fingertips, the small arteries constrict, causing reduced blood flow to the fingertips. That's why this symptom appears. This condition is medically known as Raynaud's phenomenon. Raynaud's phenomenon is most commonly seen in a disease called systemic sclerosis, scleroderma. As the name suggests, systemic sclerosis causes the skin to become harder and tighter over time. In severe cases, it may progress to interstitial lung disease, which can be life-threatening. While cold exposure can trigger this symptom, if the discoloration persists even after warming, it may be a sign of scleroderma or an autoimmune disease. It's important to seek medical evaluation if this occurs. Since this symptom is relatively easy to notice, please pay close attention to changes in finger coloration. An autoimmune diseases can also affect the mouth, so it's important to be aware of these symptoms. For example, persistent mouth ulcers that do not heal easily. This is a common symptom seen in Behçet's disease, a type of collagen disorder. In Behçet's disease, there may also be genital sores or inflammation of the uvea, uveitis, which can cause eye redness and pain, sometimes causing eye pain. So Behçet's disease is problematic because it tends to affect specific areas such as the mouth, eyes, and genitals repeatedly. In an autoimmune disease called Sjogren's syndrome, the salivary glands are affected, resulting in reduced saliva production, leading to severe dry mouth. It can also affect the tear glands, causing dry eyes. In other words, it is a disease that can dry out multiple body systems. In the United States, tennis star Venus Williams has publicly shared her diagnosis of Sjogren's syndrome. If anyone watching this has experience with an autoimmune disease, please feel free to share your story in the comments. Your experience may help others who are going through the same thing. As we've seen, an autoimmune diseases can be life-threatening and far more common than many people realize. So then, is there any way to prevent it? The short answer is, there is no universal prevention method that applies to all an autoimmune diseases. However, for certain specific types, there are preventive measures that may help. For example, in the case of rheumatoid arthritis, smoking and untreated periodontal gum disease are known risk factors, so quitting smoking and maintaining regular dental checkups to prevent gum disease are strongly recommended. In diseases like SLE, systemic lupus erythematosus, sunlight can be a trigger or worsening factor, so taking measures to avoid excessive sun exposure, such as using protection, can help. Overall, since there is no single preventive method, maintaining a balanced and healthy lifestyle and seeking medical evaluation promptly when symptoms appear is essential. And autoimmune diseases, including interstitial pneumonia, can be difficult to treat and potentially dangerous, depending on the case. However, treatment options do exist. Steroid medications are often used to reduce inflammation. Other medications, such as immunosuppressants, which suppress the overactive immune response, may also be used. And newer immune-modulating therapies have been developed in recent years. That's why early diagnosis is essential. Many people may wonder which department to visit first. The appropriate specialists are physicians in rheumatology or autoimmune/an autoimmune disease clinics. For your own health, and for the people around you, please remember and keep this information about an autoimmune diseases. An autoimmune diseases, including interstitial pneumonia, can be serious and sometimes difficult to treat. However, treatment options such as steroid medications are used to reduce inflammation. Immunosuppressants that control the overactive immune system may also be prescribed. There are also newer medications that help control the immune system more precisely. Therefore, early diagnosis is crucial. Many people may wonder which department to visit. The appropriate specialists are physicians in rheumatology or autoimmune/an autoimmune disease clinics. So, what can we do? Autoimmune diseases develop through multiple factors such as genetics, environment, infection, hormones, and stress. However, modifying lifestyle habits can help regulate the immune system and reduce inflammation. What I'm about to share is not just basic health advice. It is based on research and known to influence autoimmune conditions. The first factor is diet. One of the most common characteristics of autoimmune patients is chronic inflammation. Therefore, following an anti-inflammatory diet is essential. Vegetables, fruits, berries, olive oil, nuts, avocados, fatty fish, turmeric, ginger, and garlic can help reduce inflammation and stabilize immune activity. On the other hand, refined carbohydrates, excessive sugar, fast food, processed meat, and trans fats can worsen inflammation and trigger immune overreaction. These should be avoided as much as possible. The second factor is gut health. Most immune cells live in the intestinal lining, so a healthy gut is essential for immune balance. Fiber, fermented foods, and adequate hydration can improve gut microbiome balance and reduce immune hypersensitivity. The third factor is sleep and stress control. For autoimmune patients, stress is not just psychological, it is a strong biological trigger. Chronic stress can push the immune system into attack mode even when there is no actual threat. The fourth factor is exercise. Moderate physical activity can help restore immune balance, but excessive exercise may worsen inflammation. Fast walking, swimming, light strength training, and stretching are ideal. Consistency matters more than intensity. Now let's look at it from an Eastern medicine perspective. Traditional Korean medicine sees autoimmune disease not as a simple immune malfunction, but as a breakdown of the body's internal balance. First is deficiency. When the body becomes weak, the immune system loses its ability to distinguish friend from foe. Second is stagnation. When circulation becomes blocked, heat and inflammation build up, worsening symptoms. Third is phlegm accumulation. Inflammatory waste builds up and can cause multi-system symptoms. In traditional medicine, the goal is not to suppress immunity, but to restore balance within the immune system. These strategies cannot fully prevent autoimmune disease, but they can significantly reduce inflammation and slow disease progression. Especially if you have a family history or early warning symptoms, this is not optional. It's essential health knowledge. For your own health, and for the people around you, please make sure to remember this information about an autoimmune diseases. There are many other educational videos on our Preventive Medicine channel, so please continue learning and use them as preparation for your health. Whether you like this video or not, your feedback, likes or dislikes, helps improve future content. Thank you for watching, and I'll see you again in the next video.